while billing a health insurance company for housing costs. That's what a new program that started this year will do. KITV4's Diane finds out why advocates working to end homelessness say it makes sense.
The National Health Care for the Homeless Council says homelessness puts one at risk for poor health and vice versa. Now, a new state program hopes to bridge the gap between homelessness and health care.
So the state has a new program called Community Integrative Services, or CIS. And this program came about through approval of a Medicaid waivers.
Caseworkers can now bill insurance, which can bill Medicaid for the time they spend helping find someone housing.
So these are not typical healthcare billable services.
Medicaid for health insurance is now going to cover housing for impoverished people.
How do you expect people experiencing homelessness to take care of their health when they're not safe outdoors? So healthcare is housing. Housing is healthcare.
What CIS also does is let caseworkers take the medical help to the streets.
Medicaid is already going to pay for somebody to walk into a clinic and get services. So why is it so critical for you to take your staff out onto the streets and do what you call street medicine?
Because they're like on survival mode on the street, right? They don't have the capacity to think about calendars and schedules and keeping appointments. So it's really removing those barriers.
Menino says right now most homeless people use emergency medical services for help, like firefighters, paramedics, or the emergency room. CIS will reduce the strain on that system.
I mean, that's the goal, is to bridge access to healthcare and mental health care, so it doesn't use up the necessary services.
The program is just getting off the ground, but Menino says she is hopeful about what it can do.
My hope is that every person in our community have access to the health care and behavioral health care that they need.
Thank you, Brandy Menino, for talking to us from Hope Services. Diane, KITV4 Island News.